Have you ever heard of gout? It's a type of arthritis causing sudden, intense pain, usually hits the big toe. Welcome to this video where we talk about gout. If you haven't watched the video on arthritis, just subscribe and scroll down and you'll get the video. Let's get started. Gout is a type of arthritis that can affect anyone. It can cause severe and abrupt pain, swelling, redness, and tenderness in joints, typically the big toe. A gout attack can happen suddenly, waking you up at night with a feeling like your big toe is burning. The joint becomes hot, swollen, and so sensitive that even a light bedsheet can feel painful. Gout symptoms might appear and disappear, but there are ways to handle them and avoid flare-ups. Gout symptoms usually show up suddenly, often at night, and can include 1. Strong joint pain. Gout commonly targets the big toe, but can affect any joint, like ankles, knees, elbows, wrists, or fingers. The most intense pain usually occurs within the first 4 to 12 hours. Number 2, you have lingering discomfort. After the worst pain eases, some joint discomfort may stick around for a few days to weeks. Subsequent attacks might last longer and impact more joints. We also have swelling and redness. The affected joint becomes swollen, tender, warm, and red. Lastly, we have limited joint movement. As gout advances, it may become challenging to move your joints normally. If you suddenly feel really strong pain in a joint, contact your doctor. Ignoring untreated gout can make the pain worse and harm your joints. If you have fever and a joint is hot and swollen, which could mean an infection, get medical help right away. Gout happens when tiny crystals called urate accumulate in your joints, leading to inflammation and intense pain during a gout attack. These crystals form when there is too much uric acid in your blood. Your body makes uric acid when it breaks down purines, which are naturally present in your body. Purines are also in certain foods like red meat, organic meats like liver, and purine-rich seafood such as sardines, mussels, scallops, trout, and tuna. Drinking alcohol beverages, especially beer, and consuming drinks sweetened with fruit sugar, that is fructose, can also boost uric acid levels. Typically, uric acid dissolves in your blood and exits your body through your kidneys into urine. However, if your body produces too much uric acid or your kidneys don't eliminate enough, the excess uric acid can accumulate, forming sharp crystals in a joint or nearby tissue. These crystals cause pain, swelling, and inflammation. Now let us look at the factors that increase uric acid levels in your body. And they include 1, we have diet. Eating lots of red meat, shellfish, and consuming sugary drinks can boost uric acid levels, increasing the likelihood of gout. Drinking beer in particular can also raise the risk. Then we have weight. Being overweight leads to more uric acid production and makes it harder for your kidneys to get rid of it. Number 3, you have medical conditions. Certain health issues like untreated high blood pressure, diabetes, obesity, metabolic syndrome, and heart or kidney disease can increase the risk of gout. Medications. Some drugs such as low-dose aspirin, certain hypertension medications like thiazide diuretics or ACE inhibitors and beta blockers, and anti-rejection drugs for organ transplant recipients can raise uric acid levels. Family history. If your family has a history of gout, you are more likely to get it. Age and sex. Gout is more common in men, but women become more susceptible after menopause when their uric acid levels approach those of men. Men usually develop gout between ages 30 and 50. Then you have recent surgery or trauma. Gout attacks can be triggered by recent surgery, trauma, or in some cases, vaccination. People with gout might face more serious issues, which including recurring gout. That is, some may never have gout again, while others might experience it multiple times in a year. Medications can help prevent frequent gout attacks. If not treated, gout can damage joints. Then you have advanced gout. Without treatment, gout can lead to the formation of urate crystals, deposits called tophi under the skin. Tophi can appear in various areas like fingers, hands, feet, elbows, or Achilles tendons. Although usually not painful, they can swell and become tender during gout attacks. Then we have kidney stones. Urate crystals from gout can gather in the urinary system, causing kidney stones. Medications can lower the risk of kidney stones. Let us look at diagnosis. Doctors typically diagnose gout based on symptoms and by examining the affected joint. Tests may include drawing fluid from the joint to check for urate crystals, a blood test to measure uric acid levels, X-rays, ultrasound, or DECT scans. Gout medications come in two types. One reduces inflammation and pain during gout attacks, including NSAIDs, colchicine, and corticosteroids. The other type lowers uric acid levels in the blood to prevent complications. Medications like allopurinol limit uric acid production, while probenecid improves uric acid removal. Treatment choice depends on symptom severity and other health conditions. Thank you for tuning in. If you found this information helpful or know someone dealing with gout, don't forget to hit that like button and share the knowledge. Subscribe for more health insights. Until next time, take care and stay healthy.